Myself Dr. Rajan Kumar. Today we are going to talk about spinal tumors. So the spinal tumors are a common cause of back pain and nagging type of back pain which especially occurs in the night time, and the spine tumors are of variable presentation. So what are the clinical presentation of a spine tumor? So this is the representational diagram of our spine. We have 7 cervical spine, 12 dorsal spine, and then lumbar spine. Inside the spinal canal, we have a spinal cord, which is cervical spinal cord, dorsal spinal cord, and spinal cord ends at the level of L1 vertebral body. So below the L1 vertebral body, there is conus and cauda equina, in which there is a tuft of nerve roots which are coming out of the spinal canal. So the spinal tumor location is very much important. This is the representational diagram of our spinal cord. We have cervical spinal cord, dorsal spinal cord, and there is the conus medullaris and cauda equina, from which the roots are coming out. So our spinal cord usually ends at the level of L1 vertebral body, and the location of tumor causes variable presentation of the spinal tumors. If there is a cervical spinal tumor, then patient is having weakness of both upper limb and lower limbs. If patient is having dorsal spinal level tumor, then both of the lower limbs got weakened, but upper limbs are spared. There is no weakness in the upper limbs. And if there is a spinal tumor which lies below the spinal cord in the conus medullaris region or below cauda equina, then it is usually a kind of nerve root involvement or the nerve roots involved that leads to the particular nerve root presentation, that is called radiculopathy. So tumors may lie inside the spinal cord, intrinsic spinal cord tumors, that is astrocytoma, ependymoma kind of thing, and it may lies intradural extramedullary, that is the neurofibroma or schwannoma, and other tumors which may be outside of the spinal cord, outside of the dura mater, and these extradural tumors are of variable thing that can arise from the bony matter, vascular, or some vessels. So these are of different types. Most commonly we encounter astrocytoma, ependymoma as an intrinsic intramedullary tumors, or neurofibroma or schwannoma as intradural extramedullary tumors. So intradural extramedullary tumors usually present in the nerve root region. If there is a schwannoma or neurofibroma that arises from the nerve root, leads to that radiculopathy, or some kind of meningioma that leads to the different feature because of the compression of the either nerve roots or of the spinal cord. So diagnosis has to be made by magnetic resonance imaging with contrast, and once a diagnosis of a tumor has been established and the patient is symptomatic, the treatment is surgical. There is no role of medical management in spinal tumor, because in the spine there is very low space, and if tumor occupies that space, then spinal cord compression occurs, which leads to the variable presentation. So we have to do laminectomy, that is the opening of the spinal canal, and we have to reach the tumor under microscope, and we have to remove the tumor by preserving either the root or spinal cord for the better functionality. So our aim is to remove the tumor and no damage further to the patient. And once the tumor is removed, that's sent to the biopsy, and after that the wound got healed and the patient recovered. So if there is a back pain and it is a kind of nagging back pain, especially occurs in the night, don't ignore it. Consult your neurospecialist, get MRI done. If there is any spinal tumor, get treated. Thank you.